So this is post-operative day 1 patient. She came to us yesterday with severe pain in abdomen, grade 4 endometriosis. We have operated her. We have done a intestinal resection and anastomosis for her. She also wanted fertility conservation. Both her tubes were patent in draw, and we have done ablation of adenomyosis for her.
Okay. See, most important thing you should understand in a young girl like her who wants fertility conservation for an endometriosis, right? Remember, the minute you remove the bowel nodule, so the minute you have done resection and anastomosis, her fertility will go up. There's no question in that. That is the reason why we state that when a patient has deep endometriosis, make sure that you treat the deep endometriosis first and then allow them to do fertility, because it definitely enhances the fertility. Correct? No questions. I mean, there is no doubt in that. I guess she was somebody who was taking Dynogest for approximately 2 years.
Correct.
So what typically happens is that with Dynogest, the patient will get some symptomatic benefit. Disease will keep on growing inside, but she may get symptomatic benefit to mask her pain. Right? Beyond a point in time, even Dynogest will stop working, like how it has stopped working in her as well. Whenever you do a resection anastomosis for a patient, very important, is her bowel sound present or not? Is the abdomen distended or not? Has she passed flatus or not? What is her pulse? Right? Remember, whenever, fortunately, as we see on the monitor, her pulse is 84 per minute, completely settled pulse, right? Today, because now she is around 12 hours post surgery, you can initiate orals to her, no problem. There is no point in keeping the bowel empty for a prolonged period of time despite doing bowel resection in endometriosis.
Right.
Remember, endometriosis tissue is a tissue with a lot of neovascularization. Correct? So there is no point like malignancy to keep it empty. You may give chemo radiation and all these things. Nothing like that happens in endometriosis. Initiate patient on orals very, very quickly. Right? So which is what we are going to do. Remove her catheter, allow her to pass urine. Whenever we try of giving food, after water you give her ice creams, because ice creams, as we have mentioned multiple times, it has a very high glycemic index. Remember, this patient will get discharged in the next 24 hours. So that means 36 hours post surgery. She can plan for a conception within the next 3 months because fallopian tubes are open. All she requires is ovulation induction. Okay, nothing else needs to be told beyond this to this patient.